Non-communicable diseases, NCDs, such as cardiovascular diseases, cancers, diabetes, and chronic respiratory diseases, are the world's biggest killers and a leading cause of death in the Eastern Mediterranean region. Every year, more than 2.8 million people in the region die from NCDs. 1 in 4 of these deaths is premature, occurring before the age of 70. NCDs are a real and growing threat to people's health and development. This threat is amplified by and during emergencies. The region is host to some of the world's biggest emergencies and protracted crises. More than 102 million people are in need of healthcare services. However, during an emergency, NCDs are poorly addressed. Communicable diseases and injury management become the primary focus. NCDs are challenging during and after an emergency because they require ongoing interaction with health systems and providers for optimal management and outcomes. Suboptimal management has immediate effects on people's health, as well as lasting social and health effects. For people living with NCDs, lack of appropriate care for even a short period can result in negative health outcomes, as well as increasing poverty and insecurity and potential loss of limbs or life. Patients are less able to cope with their conditions without access to medicines, follow-up, and adequate nutrition. People living with diabetes may lose access to insulin and develop wounds that will not heal, leading to ulcers and amputations. People living with chronic kidney disease and cancers may lose access to dialysis and chemotherapy with dire consequences. People living with asthma may experience acute deterioration of their condition because of exposure to dust, smoke, or mold. Also, people living with NCDs may lose access to healthy foods and may experience certain factors like stress, leading to an uptake in tobacco and alcohol use. The COVID-19 pandemic has also severely disrupted NCD services. There is an urgent need to improve the management of NCDs in emergencies. WHO has the tools countries need to make the management of NCDs easier, like the WHO Heart Technical Package for improving cardiovascular health, and the WHO Package of Essential NCD Interventions, PEN, for improving coverage of appropriate services for patients. WHO continues to work with countries to identify priority actions to integrate NCD interventions into national emergency preparedness and response plans, and deliver these through a primary healthcare approach for better NCD management and care in emergencies. WHO has created an NCD kit to help countries address disruptions in the procurement of NCD medicines and supply chains in emergencies to reduce the risk of acute NCD complications at primary healthcare level and maintain continuity of care. Let's turn the tide on NCDs by reorienting and strengthening health systems to build healthier communities with better access to NCD medicines and care before, during, and after emergencies, and to achieve the Sustainable Development Goal target of reducing premature deaths from NCDs by 1/3 by 2030.